So we see, in fact, there's a really interesting researcher. He was an MD and a JD. So he's a doctor and a lawyer. And his quote is that 60% of all chronic disease is either caused by dental problems or related to it in some way. So 60 to 80% of chronic disease, because these kinds of low grade, long standing infections never leave the system.
Welcome back to another episode of the Peak Performance Life podcast. Today, I am very excited to have on the line Dr. Michelle Jorgensen. She is an author, speaker, teacher, biologic, holistic dentist, and health and wellness provider. After practicing traditional dentistry for 10 years, she became very sick, and through her own path to return to health, she discovered she had mercury poison from drilling out mercury fillings for her patients. This path led her to discover ways to improve her family's and her own health in all facets of life. And she found answers in the kitchen, in the garden, and at home. She has found what it takes to live well in today's world. And now with Living Well with Dr. Michelle, that's her website. And that's a book that she has as well. She wants to share those ways to live well with you. Dr. Jorgensen, thank you so much for joining us here today.
Thank you. I'm excited to be here.
Absolutely. Yeah, we're excited to have you. So let's start with a little bit of a background of your story and kind of how you got into the kind of holistic health world.
Yeah, definitely nothing that I intended to do. And I've read your story, so I think that you're probably similar situation. But I'm a dentist, and I was in practice with my father. He's actually still practicing in his mid to late 70s. So I just thought that's what I would do for my whole career. I would just go to work. I would just do the dentistry I loved and come home and everything would be great. And that's not how it worked for me. At about 10 years in, I started getting really sick. And I didn't know what it was. And so I did what everybody else always had done. I went to every doctor I could find, and I had been obviously trained in medicine, and my father was a dentist. My grandfather was an internist. I mean, this was our world, and no doctors could give me any answers. I had just terrible gut problems. Sometimes couldn't even drink water without pain. And my memory I've always had a good memory, and I couldn't complete sentences. I couldn't remember patients' names from room to room. I mean, it was noticeably, something was noticeably wrong. But the big one was numbness. I just had painful numbness all the way down my hands and my arms. I couldn't brush my teeth. I couldn't blow dry my hair. I couldn't sleep at night. And I started to not be able to hold my instruments. I just didn't have any dexterity, any strength at all. And it was just numb and painful all the time. So I actually put my practice for sale, and we didn't know what we were going to do. I was in my mid 30s, 4 young kids. This was the income for our family. So we were in a pretty bad spot. And eventually, through kind of talking to everybody I could think of, finally a dentist said, you sound so much like me. Have you looked into mercury poisoning as the problem? And I said, well, no, I mean, I knew that silver fillings had mercury in them. I'd been taught that in dental school, but I've been told they were completely safe, no issues, whatsoever. And I said, well, no, I don't have any fillings. And he said, it's not the fillings you have, it's the fillings you've been drilling out for a decade with no protection. Because when you're drilling out fillings, it vaporizes all the mercury, and where do vapors go? They go up. And the dentist's head's right above the patient's head. So for 10 years, I had been poisoning my brain because I was a cosmetic dentist. I was taking out all of these fillings because people didn't like the way they looked. So I said, I still didn't really believe him. I've been told that they were completely safe, and that if I told anybody that these fillings could be a problem for their health, that I would actually lose my license. So that's what I'd been told. And he said, well, what do you have to lose right now? You're going to lose your practice anyway. So I got tested, and that's what it was. Mercury toxicity off the charts. So mercury is a neurotoxin. So now all of a sudden, all the symptoms started making sense. My brain problems, my numbness problems, even my gut problems, because the gut's highly related to the nervous system. So that's what it was. And I had to go find, was there a way to keep doing my job and get the mercury out? Because the doctor said, well, you can't keep putting it in if you're expecting to get it out. You have to stop putting it in. So I actually found there was an organization that had protocol for this. I didn't even know they existed. They had a whole system that they called safe mercury removal. So I started doing it, and we would cover the patient head to toe. We would do all these extra precautions, a giant, vacuum under their chin, all these things. And then I wore a great big crazy looking mercury filtration mask. And so when I started coming in rooms looking like this, people were like, what's going on? Something's a little different around here. So then I would explain, the reason I was doing it. And usually people were, of course, they say, oh, I'm so sorry you're sick. And, I hope you can get feeling better. But also, well, isn't this good for me? Like, should I be breathing this stuff in? Like, is this good for me to do it this way? And, of course I'd say, well, yeah, this is actually really good for you. And it was really interesting. I just thought it would stop there. Like, I just thought that was kind of the end of it. I would just, take these fillings out safely and then I wouldn't get sick anymore and everything was fine. But patients started saying things like, my doctor's been looking for somebody like you. Can I tell him about you? So then I would start to talk to doctors and they started asking me the hard questions. They would say, well, what do you really know about fluoride? Like, I know what you were trained, but what do you really know about it? Or I've heard there's concern with root canals that they can harbor infection and even lead to like chronic disease. Is this true? And I didn't know the answers to any of these things. So I had to start just looking and researching. You said before we got on that, you're curious. And I'm the same. I'm very curious. If I don't have an answer for something, I'm going to go look until I find it. And as I started along this journey of discovery, the things I found just shocked me. I could not believe that I had grown up in the profession, had been trained in the profession, had been practicing in the profession, and I knew none of these things about how the mouth and the health of it, as well as the things that we do to it, can affect your overall health in an enormous way. So it's completely changed my practice. We now have a multi-specialty, multi-doctor practice. People come from around the world to come and see us if they have chronic disease and want answers. And it's just never where I expected to be. But here we are.
Incredible. And yeah, I also have had silver mercury fillings removed, and I was very careful to make sure the person was, certified in this protocol or practicing this protocol, and went through all the steps of the whole crazy ventilated room and all these other protection things and all that. So I think it's crazy how and you touched on fluoride as well, right? Like. Let's talk about that. I mean, what have you learned now? What do you tell your patients now about fluoride? And, people who are asking about, should I use a fluoride-free toothpaste? Do you have any recommendations there?
Yeah, so it's interesting because in dental school, we were just trained that it's the gold standard. And I did learn the genesis or the reason that all even came to be. In the 1930s and 1940s, they found some societies that had stronger teeth. And they wanted to figure out why. And what they found is that they were using well water that had a higher percentage of naturally occurring fluoride. Fluoride is something that's in our soil, naturally. So it had higher levels of fluoride naturally. So they said, well, this is awesome. Let's then utilize this and put it in all of our water, put it in our toothpaste or everything, and it's going to be able to prevent cavities. And it's true. Fluoride does make the teeth stronger. It does. But there's a couple of problems. So first of all, the whole intent of putting it in everywhere was to completely eradicate tooth decay. So that's always my first question is, did it work? Has anyone had a cavity since 1940?
Yeah. Safe to say yes.
Safe to say just a few. So it didn't work, right? It didn't achieve the desired outcome. But that's not the worrisome part. The worrisome part is that anything we put in our body, fluoride or anything, is going to act on every single cell in the body, not just the cell that we hope it works on. This is what we call a side effect, right? We have the desired effect of any kind of medication, supplement, whatever it might be, but we also have the side effect. And it's because it's going to work on every cell, no matter what. Even if we just want to be in our teeth, it's not just staying there. So what fluoride does is it actually mimics iodine. They're cousins. If you remember back to your junior high, chemistry class, you learned about the periodic table. Well, they're both in the category called halides. So there's fluoride, chlorine, iodine, bromine. They're all cousins. They look alike. So if you have higher fluoride in your system, it blocks anything that iodine activates. One of the things iodine activates is your thyroid. So you cannot, actually, interestingly enough, fluoride used to be used for patients who had hyperactive thyroids. They knew it decreased thyroid function. So now we've just blanketed it to everybody in the society. Does anyone have low thyroid function that's listening on here that you've talked to? It's like half the population does now.
Right.
How much of this is because we actually have so much fluoride in our system, it's getting in the way of iodine activating our thyroids. So this is a known side effect. Another known side effect is it changes the structure of your bones. It changes the density of the bone because it does act on teeth. Well, guess what? Teeth and bones are made of the exact same mineral complex called hydroxyapatite. If it changes that in a tooth, It's going to change that in a bone. It makes bones more brittle. So it changes the density of bones, increases risk for fracture. Another thing it does, this was a brand new study just in January of this year, showed that it actually decreases IQ levels in children.
Yes.
Direct causation, not just correlation. So this is basically, as I look at it now, I say, okay, cavities are not a deficiency of fluoride. They're actually a deficiency of minerals. So if minerals are pulled from your teeth, that's how the bacteria then crawl into the hole and they start excreting more acid, dissolving more minerals, crawling deeper into the hole. That's what a cavity is. So cavities are a deficiency of minerals. If fluoride fixed every cavity, we never got another one, would it be worth the risk of low thyroid, lower IQ, lower bone density? I don't know, maybe, but we don't even have to answer that because it doesn't stop cavities. We've had
Right.
cavities since 1940. So is it worth the risk?
Right.
No, it's so not worth the risk. And the great news is we actually have a substitute now that's as effective. Science and research has shown it's just as effective as fluoride, if not more so. What is it called? It's called hydroxyapatite. Remember, I used that word just a bit ago. It's the
Yep.
mineral teeth are made of. So cavities are a deficiency of minerals. Let's just put minerals back. That's all we have to do. So when I first really went down this rabbit hole, I couldn't find something that I loved. So I actually created a line of tooth care products that has hydroxyapatite in it. We have a tooth powder, a toothpaste, which has just come out, sold out almost immediately because everybody loves it so much. Mouthwash, a mints, all of these things that are actually teeth strengthening and supporting, just putting back the minerals that came out. So all of those things are what you use instead of fluoride. And hydroxyapatite, there's actually a little controversy about it nowadays. People say, oh, it's going to calcify your brain. It's going to calcify your kidneys. It's going to do all these things. It's actually not true when you use it in an oral care product because hydroxyapatite, simply a mineral complex. It's a bunch of minerals globbed together. Once it hits stomach acid, it breaks apart into the separate minerals. So the beautiful thing about an oral care product is anyway, it's going to get into your system through your stomach. So it's going to hit the stomach. It's going to break apart into calcium, magnesium, all these minerals that your body goes, oh, I've been needing a few more of you. Come on board. Knows what to do with it. There's no toxicity. There's no side effect because all it is something that your body already has, already makes, already recognizes, and already uses. So hydroxyapatite is absolutely across the board 100% the replacement for fluoride.
Amazing. Yeah, I've already switched. I stopped using fluoride toothpaste a long time ago. Recently started using a hydroxyapatite toothpaste as well. And yeah, so I see you have it on your website, livingwellwithdrmichelle.com. You have a bunch of your products there, including your toothpaste and mouthwash. Mouthwash is something, we've kind of heard that traditional mouthwash can be really, really bad. It can mess up your oral microbiome and different things like that. Tell us a little bit about what's in your, I see you have a mouthwash on your website. What's in your mouthwash and why is that okay compared to what's not okay about the regular mouthwash?
Did you ever use Listerine, the old yellow kind? Okay. You use it and your eyes kind of tear up a little bit, right? And you're like, that's got to be good if it feels like that, if it burns like that. Well, what the burning is from is alcohol. So most mouthwashes are high alcohol content. What does alcohol do? Well, if you cut yourself and you need stitches and you go to the hospital, they're going to swab the area with an alcohol wipe. Or when you go and get your blood drawn or whatever it is, they're going to use an alcohol wipe. Why? Because it's a disinfectant. They use it because it kills bugs. So if you have a mouthwash with high alcohol in it, it does two things. It kills bugs in your mouth, all bugs. So we all know now that there's such a benefit of this microbiome. Everybody's talking about the microbiome. Basically, it's the good bugs. Well, there's a whole microbiome in your mouth. There's a whole microbiome in your stomach and your intestines. Like there's a bunch of them. Well, if you're using something with a lot of alcohol, it's going to kill all the bugs in your mouth, all the bugs in your gut, all the bugs anywhere that happens to go. So that's why they say mouthwash causes all these biome issues. That's if you're using something that kills indiscriminately. It's killing good, it's killing bad, kills everything. Well, our mouthwash has colloidal silver in it, and colloidal silver at a concentration that kills the bad and leaves the good alone. So it's all about the parts per million or the concentration that's in there. Ours is at a concentration. We actually have independent lab tests showing it does exactly this. It kills the bad, leaves the good alone. Not only that, but the combination of the colloidal silver and the hydroxyapatite together create kind of like an armor coating on your teeth. So now you use the mouthwash, so you brush your teeth in the morning, use the mouthwash, and then you start your day. And then during that day, maybe you pick up a can of soda and you drink the soda, or maybe you drink some even lemon water. It's great for you, right? Sure, but that lemon's really acidic. Or you eat a tomato or some pineapple or, whatever it might be. Something happens during the day, or you just eat it all. And the acidity in your mouth, your mouth becomes more acidic because you eat. So now that acidity is going to go after the minerals in your teeth. But the mouthwash has created this armor coating, this hydroxyapatite coating that sticks on it because of the colloidal silver. So when the acid hits your tooth, it's going to work on this armor coating first before it ever gets to your tooth. So what it does is it leaves a long-lasting protection on the tooth past just something that's kind of, there and then gone as soon as you spit it out. It's actually staying on the teeth. Not only that, we have a whole bunch of herbals, calendula, marshmallow root, which is good if you have dry mouth, a whole bunch of other herbal things in there to strengthen the gums, to reduce inflammation, to really encourage good bacterial growth. So yes, if you're using an alcohol-containing mouthwash like Listerine, you're killing everything. Don't do it anymore. You're actually going to have more bad breath at the end of it, because a dry mouth actually equals more bacterial growth, which equals more bad breath. Don't do it. Use a mouthwash that's going to lead to tooth protection, good gum health, and good bacterial support. That's what a mouthwash should be for.
Great tips. Yeah, absolutely great. I also saw I live with this copper tongue scraper. I swear by it to everyone as well. I see you have some of those as well on your website.
Yep.
What's the benefit of that?
So tongue scraping is an old Ayurvedic technique. It was in India thousands of years ago, and they actually swear by it from a lifestyle standpoint, even things like gut microbiome, that it improves that. So I actually have an interesting personal story about a tongue scraper. Even before I started using copper is even better, and I'll tell you why. But early in my college years, had a real serious boyfriend. And, as you do with boyfriends, we might have kissed a time or two. And he told me, he said, your breath, like, I really struggle with your breath. And I mean, that like kills you, right? Like to think, oh man, I got bad breath. I was just devastated by it. And so I was on this mission to figure out, how am I going to correct my breath? Like, how am I going to fix this? So I was doing like mints. I'd carry around these things in my pocket, like all the time. I'd be dropping like little mint drops in there. And I mean, I was just absolutely so self-conscious about it nonstop. Not only that, but I had this thing called geographic tongue, which is kind of like these patchy spots on my tongue that that would hurt with acid. They would kind of come and go. And everybody told me, including my own dental training, said, nobody knows what those are for. Like, we can't get rid of them. There's nothing you can do about it. Well, one day I heard about tongue scraping, and I heard it might be good for bad breath. So I thought, I'm trying it, man. I'm trying everything I can possibly do. So I started scraping my tongue every single day. And at first I thought, this is doing nothing. I clean my tongue. Like, I brush it. People tell me this all the time. I brush my tongue. Like, it's totally cool. Well, I'm going to say to you, if you think that you do a good enough job brushing your tongue, get a tongue scraper, and one night, brush your tongue, do as good as you're ever going to do, and then scrape your tongue and see what crud comes off. It's still going to be covered. So I thought I was doing a fine job. I wasn't. I started scraping my tongue at night. And what I found was, in about 2 weeks' time, my geographic tongue went away, and it's never come back. So if anybody on here has geographic tongue, you know who you are if you're listening. It, I believe, is a yeast problem, because the tongue's like a shag carpet, and it holds things inside of all those nooks and crannies. And yeasts love to hang out in nice, warm, wet places like that. So I also believe that this can lead to yeast problems elsewhere in the body, especially in the stomach and other issues. So tongue scraping, get that off of there. Why copper? I used plastic for years, so that's all I had. Copper is actually antimicrobial. So the benefit of this is, you're going to scrape it, you're going to wash it, you're going to scrape it again, you're going to wash it until there's no more gunk coming off when you scrape. Now, when you put that tongue scraper away for the night, nothing can live on the tongue scraper if it's copper. So then when you put it back in your mouth the next morning, you're not re-inoculating or reintroducing bacteria to your tongue. Does that make sense? So if you're using one that keeps bacteria on it, then the next time you put it in the next night, you're just putting what you took off last night back in the mouth the next night. Copper won't allow you to do that. It actually kills anything on surface, so it won't grow, and so you're not going to be putting it back. So tongue scraping is phenomenal. If you have bad breath, worries about that. If you have geographic tongue, if you have gut biome issues, a lot of times even just gut dysbiosis, like it just doesn't feel good sometimes, start scraping your tongue. If you have gum disease, scrape your tongue. All of these things are reasons to scrape the tongue. And I like to scrape the tongue, then do the mouthwash. Why? Because I actually want all those herbals and microbials to get down where that new cleaned up tongue, if that makes sense. And I want them hanging out so that if we're going to share throughout the mouth, that's what we're sharing, not the yeasts that are living in that shag carpet.
Interesting. Yeah. And what about oral probiotics are kind of coming on the scene really hot right now. What is any opinion on oral probiotics these days?
Yeah. So, there's different biomes. When we talk about biomes, there's different bugs that live in your mouth because they have certain jobs. Like all the different places in the digestive system have different jobs. So the mouth has a different job than the stomach, than the large intestine, than the small intestine. They all have different jobs. So these oral probiotics, the concept is that if we put the right bugs here, they're going to stay, right? And they're going to benefit us, and they're going to fight the bad bugs, and they're going to win. The concept is good. The problem is that we're chewing them and then we're swallowing them. And the probiotics in our gut and our stomach aren't necessarily the ones we want in our mouth. So they don't really, share. So this idea of chewing it up and then swallowing it isn't necessarily great. I actually prefer to use a prebiotic. So I have in my toothpaste and in my gum health mouthwash, they both have a prebiotic. Why a prebiotic? Because we actually have the good bugs we need in our mouths, but often we don't have them in the right amounts. So what the prebiotic does is it helps feed the good bugs you already have, if that makes sense. It just, encourages all the guys you already got. Okay, guys, let's do our job. Here we are. We're going to give you some extra food today. So that's why I like those, because those are specific. Your biome is a little specific to you. So I don't know if what's in that bottle of prebiotics is exactly what you need. I mean, this is kind of crazy as a dentist. We'll see people come through for cleaning. Some people's, the plaque or stain on their teeth is yellow. Some people it's orange. Some people it's green. Some people it's brown. Some people it's black. I mean, people literally will come in with just like yellow stain all over their teeth. And it's called chromogenic bacteria. Basically, it's bacteria that make color. So what this tells us is that all of these people have a different set of biome or bacteria in their mouth. So rather than one bottle that's just a specific set of bacteria being good for every person, I don't believe that's true. I would rather just feed the good guys that are in your mouth already, if that makes sense. So that's what a prebiotic does versus a probiotic. I believe it's more universally helpful for everybody.
Great information here. And I want to get into some other stuff because I know you started as in the kind of dental niche, but you've moved into just really overall holistic health and lots of other things as well that I want to get into. But one last thing on the dental side, root canals. Tell us about, like, again, it's one of these things that you hear about the dangers of them. If you go to, and so there's a lot of confusion. Should I do one? Should I never do one? Are there cases when you do want to have a root, where you do really actually need a root canal? What can you tell us about what you've learned there?
So this was an interesting one for me because I did hundreds of root canals before that first person said, "What do you know about root canals?" And all I needed to tell them was, "Well, they're great. It saves your tooth. It's awesome. It takes the pain away." And those things are actually all true. So if you were to go to the dentist today, you had a deep cavity, the tooth was either dead or dying already. If you want to keep the tooth in your head so you can chew with it still, you can smile with it still, the answer is root canal. It's all there for a good reason, but there's a problem. So the anatomy of a tooth is that there's a main canal inside of each root. So a front tooth, you have one canal, one root. On a back tooth, you have 3 to 4 canals or roots. So they clean out the main canal when doing a root canal, take out the blood vessels, the nerve tissue, everything on the inside of the tooth. This is why the pain goes away. Really, all sensation goes away. The tooth's dead at this point, once the root canal's done. They disinfect it with bleach, still used today. That's the disinfectant of choice inside of a root canal tooth. And then they fill it up with something called gutta percha, which is a plastic-like material, kind of rubbery stuff they fill up the inside of the canal with. So The problem is that's not all that goes on in a tooth. There's the main nutrient canal, but then there's little side feeder channels that go off of that main canal. That's why when you tap your tooth, you can feel it, because there's the main canal with a nerve in it, but then there's little tiny channels that go off that have little extensions of those nerve fibers that go all the way out to the outside of your tooth. This is how you get nutrients. This is even how a cavity starts to form, because, minerals are pulled out from all the way outside of here, or how you can take a supplement and you can actually rebuild your tooth from the inside out, because minerals flow through all of these feeder channels. So when a root canal is done, those little tiny feeder channels cannot be cleaned and they cannot be filled, no matter how perfectly a root canal is done. It's impossible. They're just too small. So you always have dead tissue left in the tooth. And it's really entombed in the tooth, because once we put the plastic stuff in there, there's no more blood flow, no more lymphatic flow, no more nothing, nothing else coming in that tooth. So now it's this entombed dead tissue inside of a tooth. Anytime you have something dead, bacteria are going to find it. I always joke and say, let's say that you had a gallbladder attack and the doctor says, we're going to take your gallbladder out. We're going to clean it up. We're going to, wash it in bleach really good. We're going to put some, rubbery stuff on the inside. And then we're going to put it back in. Would we think that was going to work? It's not connected to the blood flow anymore. It's not connected to the immune system anymore. No, no dead thing can exist in the body without bacteria finding it. This is why if you get gangrene somewhere, they go and chop off the thing that has gangrene, because that dead tissue only will attract bacteria and infection. So that's what eventually happens, is bacteria find that dead tissue inside of the tooth, and then your body has to deal with it. So your immune system comes to the rescue, which is great. That's what our immune system's for. But this attacker never goes away. It's there 24/7. Every single moment of every single day. It never ends, because there's always dead stuff and the bacteria always find it. So what ends up happening is your immune system just gets tired. It's tired of fighting that. Then it can't deal with this over here. It's distracted. Its energies, the resources are used up. So we see, in fact, there's a really interesting researcher. He was an MD and a JD. So he's a doctor and a lawyer. And his quote is that 60% of all chronic disease is either caused by dental problems or related to it in some way.
Whoa.
So 60 to 80% of chronic disease, because these kinds of low-grade, long-standing infections never leave the system. They impact the immune system, the immune strength, the body's ability to keep itself well. That's like my whole book is, how do we keep ourselves well? You can't do it if you have these kinds of infections. And the tricky part with the root canal is you don't feel it, because the nerve's gone. The warning system is gone. You have no idea. So on a daily basis, I see patients who say, okay, I heard you talk about, root canals are bad. I have 3 of them. Can we just look and see what's going on? You have to look at these with something called a cone beam CT scan. That's a specialized dentist CT scan. You can find it in all specialty offices have it. So oral surgeons, endodontists, a lot of orthodontists, but more and more just general dentists are getting cone beam CT scans as well in their office. We see things on that scan that I cannot see anywhere else. One of my very favorite stories is a patient who came and she had an old root canal. And this is what I hear most often. She was like, I don't know, I just don't feel right. People don't tell me, oh, it hurts or I've got a toothache. Like it's just, I don't know. It never really felt right. So we took a regular dental x-ray, the kind they put in your mouth and they snap it in. We took a dental x-ray. We looked at it and I said, looks completely fine. Like it looks great. And I think 10 out of 10 dentists would have said this exact same thing. But I had just got my new cone beam CT scan machine. So I said, let's just go see. So we went and got a cone beam CT scan, popped it up on the screen, and my jaw dropped. There was a quarter-size hole in her jawbone that had been eaten away from bacteria at the end of her root. Now, every time she bit on that tooth, it was pushing that infection throughout her entire bloodstream. I could not see it. No dentist would have been able to see it on the x-ray. So these things are not visible without this advanced technology where we can literally turn your head inside out. I can cut away your tooth slice by slice by slice. I can see exactly what's going on at the end of the root, around the tooth. And every single day, this is exactly what I'm finding. Massive infections. Things like people who had chronic sinus infections, have had sinus surgeries 4 times, and their ENT finally says, there's nothing else I can do, but they still have infection. So they come and it's actually a failed top tooth, top root canal tooth, that the infection has eaten through the floor of the sinus and is completely filling the sinus every 10 days or so after, they take an antibiotic or they do a surgery 10 days later, it's just back and they can't figure out why. Maybe we should look at the tooth that's sitting at the base of the sinus. So we take the tooth out. So is it ever okay to do a root canal? Well, this is where I always have to give patients the option. If you have a dead or a dying tooth, I have to say to you, an option is a root canal. Legally, I have to tell you that. But I can also tell you, this is what I see. So your option is to do this if you'd like. If you don't have any chronic diseases, if you have phenomenal immune strength, if you don't have any genetic propensity towards inflammation or any of the above, get a root canal. It might get you another 5 to 10 years on that tooth, but watch it really closely. Have a cone beam CT scan done every few years. And if your symptoms start to flare, if you start to get a lot of fatigue, a lot of just inflammation in the system, I know yours was inflammation big time, so if you start to get joint pain, soreness, anything like that, you go, that root canal, I'm going to go get a root canal checked out. Or you can skip that whole thing and we can just say, let's just take your tooth out and we can replace it. And we can replace it with a ceramic dental implant. So there's no metal involved. It chews like this is an implant. It looks like a tooth. It chews like a tooth, like it's everything like a tooth. It just replaces the tooth. So a lot of people are opting.
Is that the alternative then? If I know dental implants can sometimes be costly, maybe some people can't afford it or whatever, but assuming you can afford it, just basically removing it outright and having a dental implant, in your opinion, do you think that would in the future have less potential for a bad outcome?
100%. Yes. And you don't have to replace it with a dental implant. I tell people that all the time. They'll say, well, I can't get my tooth out because I can't replace it with an implant yet. And I said, that's the wrong way to think about this. This is your health we're dealing with. Get the tooth out now. We can replace it with something removable. You can wear a retainer with a tooth on it. You could just choose not to replace it. I mean, back teeth, people do it all the time. They just don't replace it with anything. You could do a dental bridge. You can do an implant later. Don't wait to get better because you can't pay or can't afford to replace the tooth now. And that is something I tell people every single day. Let's at least get to well. Then we can get to rebuild it, in the future. But at least let's get to well, because I can't give you your health back when it's gone from this.
This is great advice. This is helping put my mind at ease, because I was always so confused, and I'm like, oh, what if down the road they tell me I got to get a root canal? I've heard all these bad things about it. I don't want to do it. What should I do? What's my alternative? So now I know. I'll just pull it and get a dental implant. Yeah, if that ever happens.
Get it out. Get it out. We do it all day long. I tell people all the time, I'm like, okay, you're going to lose 4 teeth. What? Would you like to do that? Or would you like to have your health compromised for the next, 10, 15 years? Let's get my teeth out. Exactly right. We can fix this. We can fix that. So
that's right. That's right. This is awesome. This is great so far. So I want to actually ask you then, what are some other things maybe that you've kind of been doing more of these days as you've kind of getting more into the holistic health world? What are some of the big issues that you're seeing, or things that you're helping patients with, or other big mistakes that people are making that you're seeing?
So, one of the things that I'm really seeing huge in our world today is this overwhelm with health information, right? And we both contribute to it. Here we are on a podcast telling them more stuff. But that's in our world today. I hear this so frequently from patients. They're just overwhelmed. They're confused. They're frustrated. They don't know what to do. Like one day, this kind of diet sounds, is what they're supposed to do. And the next day it's going to kill them. And it's just so frustrating. So when I was going through my own health journey, that's what I ran into. Like, it wasn't a lack of information. I just had too much information and I had no clue how to wade through it. So I started studying all kinds of alternative care practices. So Ayurveda from India, Chinese traditional medicine, German herbalism. I went everywhere. I studied all of these things in depth. And what I found is that they all have something in common. They actually all talk about the seasons of the earth and the elements of the earth. And they classify the body and our maladies or our challenges based on the seasons, which is really interesting because a lot of these are, indigenous medical practices. So that's all they had to reference was spring and summer and fall. And, these are things that have been around for thousands of years. So what I did is I actually took all of these methodologies and I put them into an assessment. So now what you can do is you can go to this assessment and you can plug in your symptoms. Plug in everything that you're experiencing currently. And what it's going to tell you at the end of the assessment is what season you're in. Now, what in the world does that mean? Well, it's using all these old methodologies. So let's say you're a little like you just can't quite get out of bed in the morning. You're really tired. Your digestion doesn't feel great. You've got some constipation. Things are just kind of slow. You feel super no motivation. That's most likely going to show up as a spring season. So it's going to be you're in spring season, which means your liver and gallbladder needs help first. Why is that important? Because now instead of saying, I've got to fix everything all at the same time, you can go, I just need to fix my liver and gallbladder. Okay. And you know what the amazing thing is? Our bodies actually know what to do. So one of my very favorite examples is if you cut your finger. If you cut your finger, you might put a Band-Aid on it, right? But does the Band-Aid heal your finger?
No.
No, it might support the healing, right? It might keep it clean. It might, keep the cut ends together, but it doesn't heal your finger. What actually heals your finger?
That's a good question. I guess the skin regenerating, your body heals it. I don't know. Yeah.
Your body heals it. Your
Yeah.
cells, they have to do the work. So, they send the immune cells in first. That's why it gets kind of red and swollen and tender. Like that's your immune cells going in, cleaning up all the mess. And then the construction cells come in and they start stitching the skin cells together in a way that they don't separate again. So the Band-Aid didn't do the work. So I'm going to tell you every single medicine, every single diet plan, every single exercise program, every single one of them is a Band-Aid. It's simply there to help your cells do what they already know how to do. Your cells do the work and they do it without you even telling them. I mean, do you have to tell them how to fix your finger?
No.
No. I mean, isn't that amazing? Isn't that miraculous?
It is.
So the question so we're asking the wrong questions. We're asking, what medicine should I use? What diet program should I follow? What, all of these kinds of things. Instead, we should be saying, what do my cells need from me in order to do the work they already know how to do? So that's what I've done with this assessment. And that's really the whole story of my book is how do we figure out what our cells need so that they can do the job that they already know how to do? And what do they know how to do? They know how to keep us well. They know how to heal. They know how to create energy so that you can wake up in the morning feeling like $1 million. Like they know how to do that, but it requires us to help them. I know your story very much aligns with that. You weren't giving your cells what they needed to not be inflamed, right?
That's right.
As soon as you started providing them with the fuel that they could use to be well and to give you the energy you needed, they did their job again. It wasn't the cells problem. It was what you were giving them. So you had to fix what you were giving them. So that's really the premise of all of this is what do your cells need in order to do the job they already know how to do? And how do you translate it? The interesting thing is in our modern medical world, we think of the symptom as the problem. We get a headache, we take ibuprofen. Instead of saying, why do we get that headache? I mean, some of us go, I don't think I drank enough today. Or, you know what I mean? I bet it was that chocolate I had at lunch. That was the headache today. So we do start to think a little bit about that. But a lot of the other symptoms we just start to cover up. Things like high blood pressure, high cholesterol, acid reflux. Like we're just covering up all these symptoms instead of saying, that's the only way my cells have to talk to me. That's it. That's the only way they can alert me that they aren't getting what they need. Your inflammation was your body's only way it could tell you what was wrong. So thankfully, you slowed down long enough to say, what does this mean? And what can I do differently so that my cells have what they need? So you did everything exactly perfect. But the challenge is finding out, what are your cells saying? Like, how do we translate that? And that's really, like I said, what my book is all about, and that assessment inside the book. So if people want the assessment, I'll tell you where to go to get that too. If you go to livingwellbook.com, you're going to be able to get the assessment. It's a digital assessment. You plug in your symptoms, and it'll pop out your season and tell you. So let's say it says you're in summer season. Well, that means your heart and your stomach need help first, need focus first. And then I tell you how to start. I tell you what stomach and heart cells need. How do you take care of them? And what does it have to do with the season at all? Well, interestingly enough, those people thousands of years ago knew a lot. So your heart and your stomach need a lot of cooling things. Guess what grows in the summer? Things like cucumbers and watermelon, which are both fabulous for healing hearts and stomachs. Isn't that cool?
Interesting.
It just classifies everything so you actually have an idea of how to give your body what your body needs and when it needs it. So that's really what I see in the world today, is that we're just locked into this point of confusion and overwhelm and frustration. And psychologically, this is a psychologically true principle. If you're confused, you can't move forward. You
Mm,
can't, simply can't. So with all of the information that we have today, if you are stuck in confusion, you can't do anything to help yourself and your body be well. So you got to
yeah.
get out of the confusion, get a step, get a way to go forward. And then all of a sudden, your body does the work.
Mm, love that. Absolutely love that. I want to get your quick kind of opinion or maybe some tips on food or ways that you think people are making mistakes in terms of what they're putting in their body. I know I saw some beautiful pictures of you. It seems you have your own little, greenhouses and farms, and you're growing food and all that kind of stuff. What are some of the things that you are seeing, kind of mistakes that people are making with their diet, or in general, what kind of a diet do you and maybe that changes with the seasons, I'm sure, and what you're trying to, what you're trying to improve on. But yeah, I would love to hear a little bit about that.
Yeah, it does change with the seasons and which cell needs help most. It does for sure. But there are some general principles. And one of them is one that I don't think people really think about. In each of your cells, there are something called mitochondria. And the
Mhm.
cells that need more energy, like your heart cells that require a lot of energy, have exponentially more mitochondria in them than, say, maybe your fingernail cell that doesn't need nearly as much energy, right? So those mitochondria are literally power plants inside of every cell. And what people don't often understand is that, just like I actually grew up in a place that had huge coal burning power plants. I'm sure we're all going to die someday because we were breathing all that exhaust. But it's all they had, because the mountains surrounding where I live were full of coal. So they would mine the coal, they would truck it over to the power plant, and then they would create power for our whole region. And what was so easy for us to understand is that power plant ran on coal, right? That ran on coal. And then when the EPA came in and said, hey, coal's too environmentally toxic, have to convert this entire thing to natural gas. Well, they couldn't just switch on a dime and start running the power plant on natural gas. That's not how it works. The same thing goes with our mitochondria. They're literal power plants, and they need certain types of fuel. So there's a huge push right now for protein. Huge push, right? Everybody's talking about how many grams of protein you should be eating a day.
Mhm.
Well, you need to understand what protein does in the body. Protein actually does not work in the power plant. It's like you got a coal burning power plant and you're starting to give it natural gas. It actually doesn't work. Protein is the last of the three fuels that your body can use for energy. So if you just need more energy, protein's not what you're supposed to be using. Protein builds muscles. Protein stimulates, it builds enzymes, so it creates a lot of chemical reactions in the system. It does all these kinds of things, but it does not translate to energy. Carbohydrates are the number one fuel source for energy. So if you are just dragging, what you should be getting is a complex carbohydrate, not a cookie, not a donut. That's going to be a quick burn and a quick die. You want a slow burn like an apple on a date. So I tell everybody, guess what every afternoon snack should be? An apple and 2 dates, because it's going to give you that energy that you need to push past 2 p.m., but it's going to be slow enough that you don't get the resultant insulin crash after the insulin clears all the system and all the glucose is gone. So you need to understand, what does the body actually use for what purpose? So if you want energy, it's carbohydrates first, fat second, not proteins. Proteins are for building muscles. Proteins are for creating enzymes and helping you digestion and all those kinds of things. So that's one thing. The next thing I really, really try to reinforce to people is that fuel has to mix with oxygen. Now, the way the mitochondria works is, if you just take one molecule of fuel, it will make 2 batteries. If you take one molecule of fuel and mix it with oxygen, it will make 34 batteries with the same amount of fuel. So oxygen is so crucial to health and performance. So you might be thinking, well, yeah, oxygen, fine. I want you to pay attention. Even those of you who are listening right now, have you breathed in the last 3 minutes? You're like doing that shallow little stuff, but really, a deep breath. We don't breathe in our society today. We suck our stomachs in. Like, we all want to look super skinny, right? So we suck our stomachs in. What does that do? That actually decreases the amount of oxygen you're able to take in. The diaphragm's down low. It's not up here. We don't breathe up in here in our chest. That's not where actually our diaphragm is. It's down here. So you need to bring that oxygen in. And then a lot of performers, this comes from also the dentistry perspective, a lot of people aren't getting enough oxygen at nighttime either. and this
Mm.
is affecting their sleep. They're not able to go to sleep well. They're not able to stay asleep well. They toss and turn all night long. They mouth breathe. They snore. All of those are signs that you are not getting adequate oxygen. So your body knows if you can't get oxygen, you shouldn't stay asleep. If you're waking up, you didn't get enough oxygen. That's why. So it woke you up. You had to wake you up, had to turn you over, had to do something. Well, if you're not getting enough oxygen at night, that's when the body goes into repair mode. That's when it rebuilds things. That's when it restores energy levels. That's when it restores and heals. If you're not getting the oxygen at night, you're not doing any of those things. So you can tape your mouth closed and you can take an Ambien. You're still not getting deep sleep. You're not there. Your mind might think you are, but you're not. So you need to really figure out, why are you not getting oxygen? Daytime, it's because we're not breathing. Nighttime is because we can't. So there's actually a lot inside of dentistry that addresses how to get more oxygen at night as well.
This is great stuff. I know we're just scratching the surface here. This is really, really great stuff. I can't wait for people to get your book. Tell people where can they find you, follow you, buy the book, maybe tell them again where they can take that assessment.
Yep, absolutely. So Living Well with Dr. Michelle. If any of this sounds interesting at all, I literally post a video every single week or more. There's so much information out there. So go check it out on all the social accounts as well as YouTube. And the book is at livingwellbook.com. You can also find it at livingwellwithdrmichelle.com, all those places. And the other question I commonly get is, where do I find a dentist like you? So I also have a dentist directory on that website. So if you go
Nice.
there, you'll find our dentist directory, which is vetted dentists who do maybe not exactly everything we do, but at least they're of the same mindset and they're thinking the same way. And you can find somebody that's closer to home for you for free. It's all free. So you just go on there and find a dentist on there as well. So this is my mission. My mission is to help people live well so that they can fulfill their mission in life. So sharing this information this is why I do that. So thank you for allowing me to do that.
Beautiful. This has been absolutely amazing. Thank you so much, Dr. Michelle. I hope we can do it again sometime.
Thank you.
Thank you. Thanks for listening. If you enjoyed the episode, can you please leave us a rating or review and subscribe? I've realized that while we have actually increased our downloads a lot, we're actually getting a lot of downloads, which I'm really happy about. We actually have very few ratings. And I realized that I've never asked people really to rate much. So I'm asking you now if you could please rate and review and subscribe. And if you enjoyed the episode, please forward it along to anyone that you think will get value out of this. Also, if you haven't checked out our line of products at buypeakperformance.com, you get 20% off your first order. That's www.buypeakperformance.com. We have some incredible products, including our organic high-altitude coffee. If you don't know this, coffee is one of the most heavily sprayed with pesticides out of any crop. So it's really important that you drink organic coffee. We've gone above and beyond to source what we believe is the highest quality and healthiest organic coffee in the world. We're also famous for our organic green superfood powder. You can get 20% off of that as well at buypeakperformance.com. We also have an organic vegan and paleo plant protein. See, most of the vegan proteins out there are using brown rice protein, which is really not a good source of protein, and it's also a grain. And if you're paleo, you know that grains tend to cause inflammation in some cases for some people. And so we wanted to make one that was paleo friendly and vegan and organic. We made an amazing amino acid profile, so it's really one of the best plant proteins for muscle building. So you can check out Peak Performance Organic Plant Protein. You can find that on our website. Of course, all our products are on Amazon as well. So thanks again. And again, please, if you enjoyed the episode, please forward it along to someone who you feel can get value out of it. And please leave us a rating, review, and subscribe. Thank you.